This is the Emergency Medical Minute, sponsored by CarePoint and HCA Health One.
All right, well, good evening, everybody who's here. So we not infrequently see patients, Narcan wake-ups, had one yesterday. We see patients who have usually unintentional opiate overdoses. They get some naloxone, and they look well when they get here. And there's a question of how long do we need to watch these patients? And, some of it depends on what they took that make them, have an opiate overdose. And a lot of times it's some kind of fentanyl, but a lot of times there's things mixed in with it. We don't know what's in it most of the time. There used to be a rule or a general guideline that, you'd watch them for about 4 hours after they got some Narcan, and if they stayed awake and were fine, they'd be safe to go. There's a question now that, maybe we don't know so much what's in people's opiates, and do we need to watch them longer? Are they going to have, like a delayed respiratory depression where they kind of have a, situation where they need to get intubated or some intervention later? So there was a study that got done, and what they looked at is a large number of patients who got Narcan for presumed opiate kind of ingestion overdose, and they wanted to see how many patients had a delayed intubation, so more than 4 hours after getting Narcan, how many patients needed something done. And out of 1,600 patients that they looked at in the study, only one out of 1,600 needed an intubation more than 4 hours after getting Narcan related to their opiates. There were a few other patients who did get intubated later, but they had kind of other medical issues going on, so it wasn't necessarily just from the opiate overdose. So I think this should make us feel pretty good. 1 out of 1,600 is a pretty small number, that generally it's very safe if we have someone, we watch them for a few hours, maybe 4 hours, and we don't know exactly what they took, but they're probably going to be okay. They're probably safe to discharge. Another kind of plug for take-home naloxone. Try and do that as much as possible, educating patients. But in general, it's probably safe. They're probably unlikely to have, significant delayed respiratory depression. Any questions or comments?
Can you just keep giving them, put them on a Narcan drip to prevent them from being intubated?
You can, if they keep having it. It should be pretty unusual that someone needs to get, intubated, because you can usually give the Narcan. But it must have been someone who was, significantly obtunded and, for whatever reason. But yeah, Narcan drips are a thing. Usually we'd start it if someone gets multiple doses of Narcan. They kind of repeatedly need it. They would get admitted, and usually you give them 2/3 of whatever dose they need. Give that over an hour. So Narcan drips can be very helpful in these people. But those people usually go into ICU and closely monitored. So thanks, everybody.
This has been the Emergency Medical Minute. Thank you to our sponsors CarePoint and HCA Health One. Support from them and listeners like you helps us to continue providing free medical education to the masses. If you found this episode valuable, consider supporting our work and check out the link in our show notes.